I'm afraid my teeth are gonna pull out when they take that impression. That's a common thing that we hear, and it's real. It's a real fear. Patients that I treat, many of them have some really loose teeth. Most of them have smoked for a long time, or it's finally time to do something like a all-on X procedure, prettau, zirconia, zygomatic, and whatever it takes. But removing all the teeth, or some teeth feel like they're gonna get ripped out on the impression, and that's really scary because the potential is very high that that can happen. Um, where the teeth get pulled out. There's a simple solution. In my practice, I use some very advanced technology where we do scanning of the teeth. That means we're taking something similar to an iPhone and putting it in the mouth and scanning the teeth by video. Video the top, video the bottom, video the sides, and that doesn't. There's no suction. We don't pull anything out that way. So being seen in an office that uses that technology obviously is going to help you tremendously. And the other thing is doing what we call facial scanning from head, from all the way from side to side, the whole face in 3D. That allows me to avoid all impressions altogether. Most of my procedures that I do don't require an impression. So if you're afraid your teeth are going to pull out, which has happened in the past when we used to use the regular, like, kind of suction molding material, the teeth can get pulled out. So this is called a digital impression. I use something called a Trios, Trios 3. It is a scanner that's made in Europe, and we've used it for many years now. And it's really impressive for the final result, not just avoiding your teeth pulling out, but what it can do beyond that, and make the teeth nice and design the bite to your face, and so that you've got good interlocking. All that's built in with good lab design, having the end in mind by using the face beforehand. But it's just a short video just to know that there are options. The other option I should mention, let's say you can't be seen by a dentist that has facial scanning, is they can do some they can put some things between your teeth, like kind of tuck in some like Teflon, or little things to prevent the impression material from grabbing in between the teeth. So that's a little tip. Teflon can work quite well, or using a small amount of impression material in the sides around any loose teeth, or bond them together so that they don't get pulled out on the impression. Even if they don't get pulled out in the impression is not accurate because the teeth were moving when it got pulled in and pulled out. But it is an option as well. It's called a blockout for a manual impression. But if there's any questions, let me know. This is Dr. Ramsey Amin, Burbank, California, burbankdentalimplants.com. Thanks so much. Take care. Stay safe during COVID-19.